Other issues, CMS, ONC, they've been putting out quite a bit of information, and if you want to talk about the latest new rule that came from those groups.
So yesterday was the deadline for submitting comments to the rule that ONC and CMS have put out on essentially interoperability. That's probably the big issue. And this comes back from an initiative from CMS Administrator Seema Vera, whose husband was in DC here, and they're from Indianapolis. They tried to get their medical records here because he had an incident in the emergency room and couldn't get it. So this has become very personal for her. And anytime you get something very personal with people, they're going to pursue it with vigor. And that's what she's done here. And so I think the rule that they've got out there, there's some good things. One is that vendors and other providers can't block information. That's important for us, especially when we're going to a PDPM, being able to access the information on a timely basis. The second is CMS has proposed a standard format for transferring electronic data that would be universally accepted across all provider lines. What that will do is it's kind of like having a standard form, and everybody does it the same way. So you'll be able to populate your health record with this data set, and when it comes in from whatever provider you're dealing with at this point in time. The other interesting one is a mandate for a patient portal. Now that's not something that we've seen in our sector. In the acute care sector, it's quite common, but we've not seen it. So how our vendors react to that will be very interesting. Whole myriad of issues with patient access to a portal. One of the issues that they propose in the rule is that the patient have full access to the health record. So if you're, let's say, a patient that uses an Epic system, which is one of the big acute care systems, you don't have full access to the record. You have partial access to the record. So she has proposed full access to the record. Will that change how physicians and hospitals develop their electronic health record? It'll be very interesting to watch.
And when these are accomplished, some of these changes, will that help in marketing for long-term post-acute care, saying something like a portal, or we're up to speed with just like the acute?
It could. It could help us distinguish ourselves in the market. I don't know how much use it's going to get. Especially if you're dealing with long-term patients. Access through a portal may or may not be the best thing in the world. You may have to set up a kiosk, you may have to do some other stuff. I think the more interesting question is who's going to have access in the family, and who you're going to authorize to have access. And then we get into the whole issue of phishing and cybersecurity and all those other areas. And so we're going to have to be very careful about segregating off that part of our software to make sure that we don't get hit with a breach by a patient or a family member.
Right.